I'm Sherry Ewing, Nursing Coordinator at Hull Child and Family Services. Welcome to Hull's online medication administration course. This course is an absolute requirement in order for any Hull staff to be authorized to dispense any medications to our clients. This course provides Hull staff with information needed in order to deal with medical and health-related issues that arise for our clients taking medications. It authorizes staff to dispense medication and promotes their knowledge of the theories behind the routines and interventions required for dispensing medications. We do have agency policies that we must adhere to, as well as an accreditation body that gives us our license to operate. Please read and be familiar with the agency policy. It's number 309.10, and it's called Staff Administration of Medication, as this course is just a supplement to that policy. Through this course, I'm hoping that we will provide you with safe guidelines for medication administration and therapy. We'll help you recognize and understand your role in medication administration, including your legal limits, which is really important. It will assist you to know how, where, and from whom to access information, another really important thing to know, and help you minimize the occurrence of medication errors. The final thing it'll do is it'll help you think responsibly and respond in a confident manner when dispensing medications. Just briefly reinforce why MAR sheets are so important. They are a legal document, and I'll just tell you a story why they are so important, just to help you understand. What happened one time is someone was very good about medication administration, did everything that you're learning today, used their MAR sheet, filled it out with medications in their signature and stuff, but happened to give an anticonvulsant and decided, well, I'll just wait till the end of my shift and sign it off. What happened was the little guy who got the medication ended up being quite sick, had seizures, and actually passed away, and so everything is quickly seized, and the MAR sheet was, and this staff in Alberta had actually not signed off yet to say they'd given the anticonvulsant. So it appeared that the child may have died because they didn't get their anticonvulsant when really they had, but the staff had just not completed the MAR sheet. So that is just one of my favorite examples as to why it can be so important. You can't white out things on it either, because it is a legal document. So if you make a mistake, even though it's so teeny tiny, you do have to cross it out and put your initial and correct it that way. So it's a complete legal document, and just remember that all the time when you're filling it out. So now we'll talk about why you really need to know medications. That is, why you need to look them up in drug reference manual or online to be really familiar with the medications you're dispensing them before you dispense them. One of the things you need to know is the desired effect of the medication. The desired effect would be why the physician has prescribed the medication, what the client needs the medication for. So some of them are really simple, like an antibiotic, where they have a sore throat and the antibiotic is treating their strep throat, and that's really pretty obvious. You still need to look up the antibiotic and understand the side effects and stuff of it, but others are more complicated. There's anticonvulsants that is a type of psychotropic medication that we use, and sometimes the desired effect is different than what you may look up in the book. You need to understand your client and why they're getting the medication. I'm just saying that because I'm thinking about Gravol. Probably you even take Gravol sometimes when you're flying, and you may be taking it to help you with the nausea, or you may be taking it for the side effect to make you really sleepy so you can sleep all the way to England. So you're taking it for the side effect. And so you need to understand the medications with these kids taking psychotropic meds or whatever meds they're taking. One of the common things that happens here at Hull is that kids are given an anticonvulsant even though they don't have seizures. So in order to understand your client, you would be looking up the say for example, Tegretol, and seeing that it's an anticonvulsant and thinking, well, I need to look deeper because I don't think this client has seizures. But then you would discover that there's a side effect to the medication that is a mood stabilizer. So what happens is the Tegretol is used by physicians to stabilize the kids' moods. So that would, that's why you would look it up, because then you'd understand that. There's also side effects to most medications. You need to understand the side effects so you can be a good advocate for the client who's taking the medications. For example, something like tetracycline causes the skin to be really sensitive to the sun. So you would want to make sure that client who just started on tetracycline had sunscreen on and a hat on if they're going out on a sunny day, because their skin will react completely differently than they're used to. Maybe something like Accutane that is given for really bad acne. You'd want to be careful to know that their skin's going to be really dry, and so they'll probably want to carry a water bottle and some moisturizer for their lips to make sure you help them handle the side effect of the medication. But then sometimes there's side effects that you don't want to happen, and you need to know those as well. Back to this acne again, treatment is called Accutane. It's really hard on the liver, so you would know that because you read about it, and you would watch for signs of problems with their liver, and you would also make sure that they went every single month for their blood test, which checks their liver to make sure that the Accutane isn't causing any problems. So just things like that. It's really important. Every single drug that you give will have desired effects and side effects that are okay that you can help them manage, and then side effects that are bad that you need to be aware of so you can get them back to the physician right away if they're having some side effects that they don't want. The last thing would be the interactions. So it's really important. In all of the drug reference manuals, it'll talk about interactions with medications. So you may be giving one kind of drug, and there may be an over-the-counter medication that you want to give. Probably the most common thing is the kid has your client has a really bad cold, and you want to help dry up all the secretions, so you want to give them Sudafed. Now, as we are talking about in this section as well, is that it's an over-the-counter medication, so you need to know the Sudafed, even though it isn't by prescription, and you need to know the prescription drugs, say they're on Risperdal. So you have a client who's on Risperdal and has a really bad cold, and you're deciding if you should give them Sudafed. So you've looked up in the book and you know all about Sudafed, and you look up Risperdal and it says, oh, I can't give anything that's a stimulant while they're on Risperdal, anything with ephedrine in it. Well, that's what pseudoephedrine has in it, is ephedrine, and it'll actually change the effect of the Risperdal. Even better, and what you need to do as well, is to check with the pharmacy or myself or the physician before you give any medication, just because the interactions can be so complicated and it's really hard to understand what they might be. There's lots of drugs that interact. In our over-the-counter list, I put stars beside all of the ones that you need to be really careful with. Pseudoephedrine, of course, is one of them, or it's called Sudafed over-the-counter. But so are lots of other things interact, especially with the type of meds that the kids at Hull take. So just be really careful and make sure you contact the pharmacist, because they really know what drugs will interact badly and if you can give them. Okay, so next we're going to talk about universal precautions, also known as universal standards, which is how you deal with body fluids and discharges. All health staff may occasionally encounter body fluids and discharges of clients or other staff. You even have to protect clients and other staff from yourself and from strangers. So universal precautions is essentially protecting everyone from the body fluids of other people. Bloodborne pathogens are what we call the things that are in the body fluids that we're worried about. and that would be HIV/AIDS, hepatitis B, and hepatitis C. So those are the three things that we worry about, because those bloodborne pathogens are things that we can't cure you of if you get them, and you can get them by exchanging body fluid. So I just thought I'd tell you also that HIV only lives about 2 minutes outside the body, but hepatitis B can live up to 4 days, and even worse, hepatitis C can live for 3 weeks outside the body. So that's why people are so worried about hepatitis C, because it can be on, the most common thing would be a needle laying out on the ground somewhere, and there'll actually be hepatitis C on it for 3 weeks before it's dead. And so it is really dangerous to touch anything that might have been in contact with other people's body fluids.